Good afternoon. So I am Dr. Sushil Kumar Chaudhary, working as Associate Professor in Department of Neonatology. So there are few of my seniors and teachers are there. One is Dr. Priyanshu and Dr. Gayatri also. So I want to welcome them first off, and want to thank you, Dr. Kuldeep sir, to giving this opportunity to present this rare center for the rare diseases. So I will just tell a story how this center was started. So one of our senior professor, Dr. Arun Singh, once he diagnosed a rare disease. The child survived. He was in the news. And after 2 years, the mother again came to the same hospital with a complaint of that my child is not able to sit. My child is not able to view anything. Even he is not responding to any voice. So whatever effort we made in diagnosis in any disease, if we are not following up them properly, then even we are not aware what is our real outcomes. The second story begins with me. So I joined at AM Jodhpur on 1st of January. So I was simultaneously selected in multiple examinations, UPSC, Rajasthan, RPSC, and AM Jodhpur. So I came to AM Jodhpur on 30th of December. I did my formality. So I was given a list of certificates that also include a medical examination. So I have to visit 10 departments. So I started my journey early in the morning with my OPD sleeps, and it not ended at 5 o'clock. The day was ended. Next day morning, I got my medical. And some of my colleague who was very good in the finance, he told me that your increment is late by 6 months. So each month you have a loss of 4,000. Your whole life you will be around 80 lakh loss. Just for example, if a healthy faculty have to visit for 10 departments, it's not possible in one day. So a baby with a rare disease with multiple issues, you're all aware that a baby with any rare disease have a lot of issues, including the vision, including the cognition, including the social. Then we realize how it is possible for the parents to come morning OPD and visit a 10 center in a day. And then each domain is calling for follow-up weekly, twice weekly. Then how it is possible for a parents? Just by two philosophy that you have a lot of knowledge, but you bring the all knowledge in the one roof. You all from the medical colleges, you are doing a lot of good services. Everyone have each expertise. But the main problem as a parent's perspective is, it's not practically possible to follow up all the domain by any parents. So just by this philosophy that you have every facility, you just make sure that the patient don't have to visit a multiple places or multiple OPD. There are a lot of issue with units, their OPD days, their procedure days. So on the basis of this, the center was established almost 3 years back. And then we started to doing our services. What we are doing, it is model means, it is just, we want to show that this should be the ideal setting for the patient care and the training. Early intervention means, most of the disease, if you intervene early, all of you are aware, especially the neurological problems. Grossly, if you intervene before the 3 years of age, then your results are good. So we are taking an age of, depending on the patient's number, that 6 year our cutoffs. So we are managing all the baby less than 6 years of age. So what we are doing actually? So we have, this center have roughly 30 rooms, and you can say 20 or 25 experts of different domain. You will not believe they are not, most of them are not doctors. They are trained person, they are technicians. So we have grossly our major domains are optometry, audiology, pediatric dentistry, physiotherapist, occupational therapist, prosthetist. neurophysiologist, speech and language therapist, social educator, psychologist. So grossly, we have roughly 20 domains in which we are working. This is our center, this entrance, this center. These are different areas of this early intervention centers. In my pediatric days, I'm not sure what is your current situation. In my pediatric days, we have any rare disease we diagnose, we are sending them for, if they have some tonal abnormality, some CNS abnormality, we are sending them, referring them to the PMR department. Or we are advising to do the passive stretching. If the muscle is tight, you just do the passive stretching. That much knowledge I had till I was joined as a faculty also. Then later, when I realized that that knowledge is not sufficient to manage those kind of baby, so we took expert advice from the different experts who are actually working in the India alone, like Indian Institute of Different Cerebral Palsy, Hearing and Speech, Mysore. Then we realized that we are actually not focusing on those babies. So we try to recruit those experts as our mentor, faculties, and now slowly they are teaching and training us that there is a lot of knowledge lacuna is there, especially in the pediatrician. So this is just for example, this is our pediatric dentist. So a child with Down syndrome or any trisomy or any congenital anomaly, we are focusing on if suppose the primary illness is not treatable, but at least we can reduce the pain the child is having with those dental caries. We can improve the nutrition of the baby if the child can swallow or chew its own food without pain. Even you will not believe the best of the schools of Jodhpur have more than 40% of caries in the pediatric child. Even you go home and if you have kids, you yourself examine, you will find that they also have caries, even we are ignoring them. So we have this pediatric dentistry division who is just, any baby is coming with any intervention, he's just screening those baby. If they are something abnormal, they are doing its management. So a lot of departments are helping us, especially the pediatric department. So the pediatric neurology and Dr. Lokesh, he is giving his expert opinion for all those babies in this center. Ophthalmology department is giving all the necessary help for the screening and the management of the baby. The orthopedic department, the person who is sitting is a faculty in the orthopedic department. So they have decided their days or hours and they are coming to manage those baby again under the one roof. The baby is coming just at one place. He or the parent doesn't have to go any place. Even the investigation, the OPD sleep, everything is happening at one place. This is this ophthalmology screening done by our optometrist. What they are doing, they are screening each and every baby of any problem of any rare disease or a preterm baby or any abnormal finding. They have a lot of babies with abnormal corneas, abnormal intraocular pressure, lot of fundus abnormalities. Just for one article I want to share, this is, I will say this is a most underreported articles. So what they do, there's Ophtha team from AIMS Delhi RP Center, they just visited to the blind schools. There are a lot of related articles to this. And but they found that even by prescribing simple glasses, the 40 or 50% babies of blind school from Delhi were shifted to the normal schools. You can see the impact of even the person who are screening those baby were not aware that how to screen an abnormal baby with a poor vision. Even I was not aware how to screen a 4-year-old child who is not cooperating very well. So you are labeling them poor vision. Sometimes they are labeled as blind. They are sent to a blind school. And once a young child's brain start to read the language of the blind schools, his brain will never understand the actual vision. So again, this early recognition with good tools, with good expertise, and then simple spectacles. What they advise, they have given simple glasses with a adequate power. We are just screening each baby who is coming with that, with grossly with this hearing screens, ECG screenings, all those EEG and the neurophysiological studies. And this is our therapist room. So what, even you will not believe, a lot of times we realize that if a child is not able to see, then we are doing some intervention, we are advising something. But one of our senior physiotherapists tell us, if a child is not able to hold its neck, the main focus is to balance the body, how he will focus on any object or anything. So what they are doing, they are 4 or 5% of expert. They include this physiotherapist, occupational therapist, speech therapist. They are doing working in a single place, or you can say single hole. So they are looking at baby holistically. So one person is telling the ideal posture of the baby. So even they made some homemade devices for the babies who are from the village backgrounds. So once the baby have a normal posture, normal balance, then you can focus on the vision and the vision rehabilitation therapies. These are the few conditions we still have. Most of the time we have a lot of baby of congenital adrenal hyperplasia, and few babies referred from the genetic departments of the pediatrics and other departments. So till now we have 1 or 2 baby of urea cycle disorder, 1 methylmalonic acidemia in our follow-up, all those babies. And this is the gross data. We are how many babies we are measuring of other problems like prematurity, cerebral palsy, behavior disorders. And this is our census. In the last 2 years, you can see the number are rising. We just started, and we hope that all other department will one by one come and help us. So at least the results, we are not sure how the baby will improve of those disease, but at least we can give a comfort to the parents and the baby. Any questions? Thank you.